If you are suffering from uncomfortable and painful sinusitis symptoms and medication is just not working, our next guest is here to tell us about a minimally invasive in-office procedure for patients seeking relief. Please welcome Dr. Daniel Charous with IMS Sinus Center. Great to see you. So what is sinusitis and how is it typically treated?
Sinusitis is an inflammation of the sinuses. The sinuses are air-filled spaces that we all have in the bones of the face. They drain through minute holes into the sides of the nose, and so when you're sick or have allergies, the lining of the nose, we call that the mucosa, gets inflamed, blocks the sinuses from draining, and we call that a sinus infection. You know, we all know people, perhaps we're those people ourselves, the facial pain, pressure in the forehead and the cheeks, congestion, nasal drainage, thick nasal mucus. We all kind of recognize this as sinus-related issues. Some people get better with treatment. That's great, but then it recurs. That's telling us that there may be something structural that we can do about it. Some patients wind up getting a cold or an allergy problem or a sinus infection, and it doesn't go away, and that's more of a chronic situation when it can't even be treated by medicine anymore.
And the medicine is like over-the-counter type medications that we may see.
Well, and it could be. It could be the variety of decongestants, but, you know, antibiotics prescribed by a doctor, nasal steroid sprays, even oral steroids, just to try to get people better again. These are all part of the medical management that we talk about when we talk about conservative treatment of sinusitis, irrigations, washes, this type of thing.
And you do a procedure, a so-called procedure called balloon sinuplasty, or BSP. What is that?
So traditionally, if you were the kind of patient who had chronic sinus problems and you weren't getting better with medicine, you might be referred to have sinus surgery to open up sinus passages. With balloon sinuplasty, this is a minimally invasive office-based procedure. And so what we're doing is going in through the nose with a very thin, flexible wire to find just the natural opening of the sinus. So there's no cutting or removing tissue or causing scar. And the wire's threaded, and then we inflate a small temporary balloon. This just stays inflated for a few moments. And you can see how the balloon's inflating and the natural opening of the sinus is just getting remodeled, which will actually stay open. We then remove that catheter, and in addition, if there's some debris present, we can actually irrigate the sinus while we're doing it, and that's what this is showing here, a little saline irrigation into the sinus.
Wow, very descriptive animation. And is this painful and is it safe?
The anesthesia protocol that we've developed has really been greatly accepted by our patients. The nose is completely numb, they're relaxed, they're pain-free, we've got a nice dark room, we've got the music of their choice. It really isn't painful.
And who's a good candidate for this, very quickly?
All the patients who are suffered for years with chronic sinus problems that haven't gotten the relief. They couldn't have surgery, they couldn't take the time off work, they had too many medical problems that would have even made surgery an option in the first place.
And when I look at that video, I mean, that's come a long way from folks who just, you know, maybe have even had surgery. How come this type of treatment, or can you explain to us how this type of treatment over traditional surgery may be a better option for folks?
You know, this procedure is really revolutionary. In the past, if we wanted to open sinuses, we'd have to go to surgery, and so many people wouldn't have it. A week of recovery. This procedure is just 1 or 2 days, typically about 2 days. Significant post-procedure discomfort. You know, when we talk about treatment options, if we could do something that's going to be a quicker recovery, perhaps cheaper, less expensive for the patient, and better tolerated, and done in a familiar office-based setting, well, I think for a lot of patients this would be a really great option.
IMS Sinus Center is located at 13555 West McDowell Road, Suite 104 in Goodyear. To book an appointment, call their office at 623-428-2456 or visit their website at sinuscenteraz.com.